It's been well over a year now since Dallas McCarver's passing, and I decided to re-release my video review of his autopsy. It's still going on. I still see men coming in harmed organically from anabolic steroid use. And people do ask, where are the bodies? Well, the bodies are coming into my office, and fortunately the bodies walk into my office. Dallas McCarver was just an unbelievable case where his organs were so diseased, from his lungs to his heart, obviously, and his liver enlargement was just outstanding. And it's amazing that that happened to him, and he was living with that for maybe 18 months or so. So this is a warning to all the young men in the world that are using steroids. You have to be careful, and I would consider not even doing your research. I did my research. I would consider not even using steroids, because as soon as you start getting into this world, it's going to probably continue. And as I tell all my patients that come in, you're here to see me because I'm probably going to have to continue giving you testosterone at least for the rest of your life. So that's probably what's going to happen if you start using steroids, with or without PCT. So that's my warning. I hope this video is enjoyed and is going to be educational for people, including caregivers in the world. Thank you so much.
So Doc, Dallas McCarver's autopsy was recently released. I got note of it, you got note of it. Let's get right into it and let's do a nice analysis of his autopsy.
Okay, thank you very much, Matt. Well, we've been waiting this for quite some time, and this one, guys, this one is incredible. This is a complicated one. And I'd like to do, at the end, a comparison and contrast of the issues versus Rich Piana's autopsy. I think that'll be interesting.
Yeah, I think that'd be great.
That was actually one of your ideas. So, okay, so Dallas McCarver, date of death was August 22nd, 2017. This is from the Office of the District of Medical Examiner, District 15, State of Florida. He was a 26-year-old man at the time of his death. The date of the autopsy is the next day, August 23rd, at 10 o'clock in the morning. And this was actually released and signed by the medical examiner November 15th, 2017. So it is interesting for how much time it takes for this certified document to be made public. Okay, with that, autopsy findings, we start with that in the summary. Severe cardiomegaly, 833 gram heart with concentric left ventricular hypertrophy. Okay. The normal heart is about 300 grams. This is 800 grams. This is close to 1 kilogram. Your heart close to a kilogram, when a normal heart, even for a man, is about 300 grams. Okay. Next one, number 2, coronary artery atherosclerosis, severe in the left anterior descending artery. It's known as the widowmaker to some of the average men that have a heart attack in their life. He has moderate disease in his right coronary artery. So this is the plaque. This is the heart disease. This is the actual plaque. That's plaque. He has severe plaque development in his coronary arteries, in addition to his hugely enlarged, massive heart. Now it becomes peculiar. This is something that I don't see often. Those things I actually see often. Not to that extent, obviously, with a 26-year-old man. Heavy lungs. It says heavy lungs. His right lung was 617 grams. The average lung is about 400 to 450 grams, maybe up to 500. His left lung is 619 grams. The right lung is typically a little bit heavier than the right lung, based on the anatomy of that part of the body. It says without hyperinflation or mucus plugging. So he didn't have a pneumonia and infection, and he didn't have hyperinflation, means he didn't have features consistent with a chronic obstructive pulmonary disease, emphysema, bronchitis. We see enlarged lungs with someone that has COPD. It's classic. He didn't have COPD. They make a distinction on that right there. So next, keep moving along. Number 4, hepatomegaly. 4,593 gram, 4.5 kilogram liver. The average liver is about 1.5. Absolutely ginormous liver. Absolutely ginormous liver. Number 5, minimal nephrosclerosis with hypertrophy of kidneys. 456 grams on the right, 503 on the left, and large kidneys. Papillary, which is interesting. So he has organomegaly. So all these organs in his cavity, from his thorax to his abdomen, are massively enlarged. One piece, and the last piece on this, on the autopsy findings, is he had papillary thyroid carcinoma. So he had a very common form of thyroid cancer. Okay, and they say on this piece, non-contributory. Cause of death, unlike Rich Piana, where it said they were undetermined, it's determined in this case, very clearly determined. Severe concentric left ventricular hypertrophy. That's a massively enlarged heart with coronary artery atherosclerosis. Yes, he had a heart attack. And it's multifactorial in the end. He had a heart attack. Contributing conditions, it says. Chronic use. This is right off the report. This is straight off the report. This is not me. This is a medical examiner. They don't know much about steroids, I can tell you that. Not like I do. Chronic use of exogenous steroid and non-steroid hormones. Anabolic steroids, insulin, GH, IGF-alpha. Manner of death. This is a standard format. Natural. He died naturally from a heart attack. And obviously contributions to his enlarged heart, not to mention organomegaly of his lungs. So that's the basic overview, generalized, of why this man died.
So Doc, can we get into a little bit of kind of what you think about his autopsy cause of death? I know there was a ton of talk about how his cause of death was insulin related. He choked.
Excellent.
What are you thinking, Doc? After reading the report.
Now we can go back. Now, this is science now, folks. Now we can go back. He did not die from choking on a bagel. It just didn't happen. Did it contribute to it? No. We could argue and piss and moan forever about this stuff. And it doesn't even talk about the paramedics' findings, contributing findings of hypoglycemia from insulin. It just does not. It's just not mentioned. These are not fools. These are expert pathologists, and they work in the field. They work with findings from the field with paramedics. When you read page 2, and I'm going to read in the end one of the synopsis of the paragraph that's incredibly relevant for steroid users and what my movement and what my scope and what I'm here for. And you can see I'm very serious in this one. I'm a loving, caring doc, but I have to have a strong tone on this one. And you could smash people could put me down and smash whatever they want. It says in here when they responded to him, he was pulseless. He was in cardiac arrested for who knows how, quite some time. They tried to revive him. Unlike Rich, they didn't revive him. At that time, he probably just had a massive heart attack, and he happened to be eating. It's just incidental that he was eating. So in this event, this is where I call the moons lined up. There's no question. And it does talk about in the past that he collapsed in March. It says, let me read what it says. This is so important. I can't tell everyone out there how important this autopsy in this man's life is, a critical life that we could learn from. In the opinion of the medical examiner, Dr. Stacy Simmons, Mr. McCarver was a 26-year-old bodybuilder with a medical history including dyslipidemia, low HDL, it says, and high LDL, elevated aminotransferases, liver enzymes, a chronic cough with some episodes associated with shortness of breath. Can you imagine she goes into this? Mr. McCarver had a history of using non-prescription exogenous steroid and non-steroid hormones. He also had a reported family history of early onset coronary artery atherosclerosis, heart disease, and hypertension. He collapsed, it says here, in March 2017 at a competition during a period of ongoing respiratory symptoms. During a follow-up evaluation, an abnormal electrocardiograph, and met minimum voltage criteria for left ventricular hypertrophy. That's it. That's the end of the first page. So for all the people that said that Dallas choked on a bagel because he just choked, for all the people that said Dallas was on the stage in his competition and the prep was tough and he was fighting an upper respiratory infection, his lungs were ginormous and he had a ginormous heart and he had massive plaque in his arteries. That's the beginning of the moons lined up. I mean, he just certainly could have arrested right then and there. Now, let's talk about what causes this. Let's talk about what causes this. Steroids themselves people have been using them for decades and decades, and they enlarge the heart itself, and they could progress arterial sclerosis. Okay, so that's been known. So that's a piece. He has bad family history. That's just bad luck, and he's going to have heart disease anyway. I mean, there are men in their late 20s and 30s that have heart disease and heart attacks anyway. I see it. They've never touched a steroid in their life. They picked the wrong parents. How do you like that? Pick the wrong mom and dad. That's okay. You got to work around these things. So, insulin and IGF alpha and growth hormone and all this stuff and SARMs and peptides. So this is the game playing piece. This is where you accelerate and cause organomegaly. I've never seen enlarged lungs, of course, that are not related to COPD. I see that all the time. My sweetheart patients, they're smokers, and unfortunately they smoke for years, and they have inflated lungs. They have COPD. Those are large lungs. They're inflated. It says right here they're not inflated, without hyperinflation. So those were large, just massive lungs from growth factors. We don't even see this. I can imagine what it takes. That moon's lining up. The steroids, the androgen receptors are fully stimulated. I assume there's androgen receptors in the lungs. Who knows? The heart has them, that's for sure. Then you throw in insulin. So in this case, is it just a freak? Is it just unfortunately just a misnomer? Is it just an artifact? What is this? Well, you could feel what you want to feel, and you could argue it, and you could say it's meaningless, but it's, in my opinion, the amount of drugs synergistically, and I'm going to read something in the end. It talks about synergy. I mean, this medical examiner really put a lot out here, references, literature references in regard to this. There's no question that this man had bad genes on end. He had bad luck on end. He made bad choices on end. He used a lot of these drugs, which God knows people are using, and everything grew, and he died. 26 years old. And there was a warning. That shortness of breath and that he had an electrocardiogram and shortness of breath was picked up. Why didn't he stop and someone help him? When he collapsed and he had a medical exam, someone did a goddamn EKG. Did anyone think about doing an echo or maybe a goddamn x-ray of his chest? I am pissed off.
So, Doc, the last statements of the medical examiner, could you just get into what they had mentioned?
Yeah. So when you read these reports, I mean, but beyond the standard format, they have a basic format that's kind of like a summary, in the end, summarizing. They will put relevant literature and their relevant features, if you will, and contributions. Okay. Now I want to read this to the world. Mr. McCarver's death occurred after an unwitnessed acute cardiac event and is due to his predisposing severe concentric left ventricular hypertrophy with coronary artery atherosclerosis in a setting of chronic use of exogenous steroid and non-steroid hormones. There is significant overlap in features related to natural occurring and or familial cardiovascular disease, and those resulting from chronic use of exogenous hormones. And these factors are best viewed as synergistic contributions to Mr. McCarver's premature death. Wow. That doctor put it perfectly. So for anyone out there that thinks this is some anomaly again, or he didn't really have a heart attack, really, he absolutely had a heart attack. And the features, unlike Rich Piana, where he had minimal coronary plaque. I understand people don't know these things. It's hard for them to get their head around. Doc, heart disease. The heart's enlarged. Is that disease? What is that? Versus the arteries are plaqued and filled up. Obstructive coronary artery disease is where the plaque in the artery that feeds the heart, called the coronary artery, is blocked. Heart attack. #1 killer in America. Probably not steroid contributions to that big number of America. That's men and women, just old age, die of a heart attack. Okay. And then you have contributions of the left ventricular. I talk about it all the time. LVH, guys, heart enlarges. There's studies that steroids grow the heart, and in addition to this, it grows the heart, and it also puts plaque in the artery. So that's what happened, and he dropped from that. He had a cardiac. It says unwitnessed acute cardiac event, not from insulin, and not from choking.
So, Doc, this is just a call to action, if you will. Something needs to be done. Your voice is out there. These videos are out there to help people. Unfortunately, Rich Piana's passing and Dallas McCarver's passing. This is obviously something needs to be done. Your book is coming out. You're here to help. These videos are to help, like I said. Please reach out to the Metabolic Doc, and more things to come.
And with this, we conclude. I want everyone to stay strong and healthy, and of course, always safe. Thank you so much. Dr. Thomas O'Connor here. I'm glad you made it to the end of the video. If you liked it, hit the like button, and please subscribe to our channel. And I look forward to bringing you more cool and interesting videos just like this in the future. Stay strong and healthy.